Medieval doctors had one of the most dangerous habits in human history. They would look at a sick person, someone pale, sweating, weak, barely hanging on, and go, "You know what this person needs? Less blood," which is a bold medical opinion, because blood is quite famously one of the things people need inside them. But for hundreds of years, if you got ill, there was a very real chance a doctor would try to fix you by opening a vein. Headache? Blood? Fever? Blood? Too sad? Blood? Probably blood. And the reason for this was the four humours. This was the big medical theory. Your body was believed to contain four important fluids: blood, phlegm, yellow bile, black bile. And if those fluids were balanced, congratulations, you were healthy. If they were not balanced, congratulations. Someone is about to do something upsetting to you. Because illness was not seen as germs attacking you. They did not know about germs. They were thinking his internal juice situation is off. So the job of a doctor was to restore balance. Sometimes that meant changing your diet. Sometimes it meant herbs. Sometimes it meant rest. And sometimes it meant a confident man with a blade saying, "Hold still." That is the part where things get exciting, because bloodletting became one of the most common treatments in Europe for a very, very long time. Not because doctors were cartoon villains. That would actually make more sense, but because inside their system it sounded logical. Too much blood? Remove blood. Too hot? Cool the body down. Too moist? Dry it out. It is wrong, obviously. Very wrong. Spectacularly wrong. But you can see the shape of the idea. And that is what makes it scary. Bad medicine is not always random. Sometimes it has a whole theory behind it. A wrong theory, with confidence, which is the most dangerous kind of theory. And then came the leeches, because apparently cutting people open was not always enough. Sometimes the solution was to attach a worm to you and let it drink. Imagine going to the doctor with a headache and he comes back with a jar full of tiny vampires. And he is calm. That is the worst part. He is not panicking. He thinks this is healthcare. Leeches were used for bloodletting because they suck blood slowly, and they were believed to help restore the balance of the humours. So a medieval patient could be lying there, ill, confused, and now covered in worms. And everyone in the room is acting like progress is happening. To be fair, leeches are not completely useless. Modern medicine does still use medicinal leeches in very specific surgical situations. But medieval doctors were not using them because they understood microsurgery and blood flow properly. They were using them because they thought your body was spiritually overheating like a bad laptop. Different vibe, and if bleeding did not work, there were other options: vomiting, purging, enemas, blisters. Basically, if something could leave your body, medieval medicine wanted to know why it had not left already. The whole system had this energy of, maybe the illness is inside. Let's make the inside come outside. Which is not a sentence you want near your doctor. But this was the logic. Disease was imbalance. So treatment often meant forcing the body to remove something: blood, bile, phlegm, whatever they thought was causing the problem. Medieval doctors were not just treating illness, they were trying to evict it. And then we need to talk about diagnosis, because before blood tests, x-rays, scans, antibiotics, microscopes, and actual germ theory, doctors had to work with what they had. And what they had was often a bottle of your urine. A lot of medieval diagnosis involved uroscopy. That means studying urine, color, cloudiness, sediment, smell, texture, the little things floating in it. Medieval physicians had urine flasks and charts, and they genuinely believed the state of your urine could reveal what was happening inside the body, which means you could turn up sick, and the doctor might not even look at you first. He might look at your wee like it had betrayed national secrets. And the wild thing is, this was not always stupid. Urine can reveal things about health. Even today, doctors test urine. The problem is medieval doctors were sometimes trying to read it like a cursed weather forecast. This shade means fever. This cloud means trouble. These specks mean something in your lungs. This color means your liver is being dramatic. At some point, the urine became less of a sample and more of a crystal ball. Imagine being seriously ill, and your doctor is across the room holding your pee up to the light like he is judging wine. Interesting notes. No idea if you'll survive. And then there were barber surgeons. Because if you needed something properly physical done, the university-trained physician was often not the one doing it. Surgery was messy, blood, pain, bad smells, risk. The kind of thing educated doctors could look at and go, that feels like someone else's problem. So a lot of practical surgery fell to barber surgeons. Yes, barbers, the haircut people. You could go to a barber to get your beard trimmed, your tooth pulled, your wound treated, your bone set, or your blood drained. That is the worst menu in history. Just a trim today, sir? Actually, could you also remove this tooth and maybe open a vein? No problem, same chair. This is why the old barber pole is traditionally associated with blood and bandages. Because the barbers were not just fading people up. They were also doing the kind of medical work that would make a modern receptionist call security. A system can look sensible for centuries until someone finally gets a microscope and goes, "Guys, I think it might not be the black bile.